Greetings to all committee members of Case Study. Let me introduce myself, Pushpalata Maradamuttu. I have successfully done my clinical internship 1 at KPG Lapling HQ for 16 weeks. My case study is about diagnosis of jaundice in newborn. Before I continue to my case study, let me introduce what is jaundice is all about. Jaundice is caused by the buildup of bilirubin in the blood. Bilirubin is a yellow substance produced when red blood cells are broken down. It presents at 2 or 3 days old, begins to disappear towards the end of the first week, and has resolved by day 10. Jaundice is caused by the buildup of bilirubin in the blood. Bilirubin is a yellow substance produced when red blood cells are broken down. Jaundice is common in newborn babies because babies have high level of red blood cells in their blood, which are broken down and replaced frequently. The liver in newborn babies is not fully developed, so it's less effective at removing the bilirubin from the blood. Let me move on to the case description. It's about a 1-month-old Malaysian Malay baby boy. There was even presence of protrusions in his umbilical side while crying. The physical examinations is the local examination reveals hysteric tongue and eye or skin. Umbilical hernia is present. Cerebral vascular system per abdomen examination reveals tenderness of flank, hepatoma splenomegaly, and umbilical hernia. The methodology. The sample collected was urine, stool, and rectal swab from the baby. The sample processing is about laboratory worksheet prepared for received sample. The urine sample is cultured on CNA blood agar and McConkey agar. The CNA blood agar is stored on CO2 incubator for 1 day, and McConkey agar stored on O2 incubator for 1 day, 24 hours. Continue. The stool sample was cultured on peptone, then transferred to TCBS, that is thiosulfate citral bile salt sucrose agar, XLD agar from selenite broth, and sorbitol McConkey from TSB. Then the rectal swab was cultured on peptone, then it is transferred to TCBS agar, the XLD agar from selenite broth, and the blood agar and McConkey agar. This sample is stored for 1 day after the cultured for 24 hours. This is the result after cultured for 1 day, that is 24 hours. After 24 hours, there will be a growth on blood agar, no growth on CNA agar, and there is a growth in McConkey agar. Opaque grayish and white colonies on blood agar is seen. Pink or light pink mucoid colonies on McConkey agar, and there is no growth on Columbia agar, that is CNA agar. The sample is the Enterobacter cholerae growth is identified using the MALDI-TOF, that VTEC MS. The source of infection shows primary infection of urinary tract and ears, but can infect all areas of the body, normally found in feces. They're routinely susceptible to amikacin, Bactrim, ciprofloxacin, tetracycline, doxycycline, chlorpheniramine, sulfatramat, neomycin, cetrafzidime, marbofloxacin, nitroflurantoin, and ticarcillin. It is routinely resistant to ampicillin, penicillin, scleromox, cephalotin, clemifene, and erythromycin. The discussions about the case study. The most important test to document Enterobacter infection is culture. When the patient presents with sign of systemic inflammation, example fever, tachycardia, and tachypnea, with or without shock, example hypotension, decreased urinary output, blood cultures are mandatory. The direct gram staining of the specimen is also useful because it allows rapid diagnosis of an infection caused by gram-negative bacilli and helps in selection of antibiotics with known activity against most of these bacteria. In the laboratory, growth of Enterobacter isolates is expected to be detectable in 24 hours or less. Enterobacter species grow rapidly on selective, that is McConkey agar, and non-selective sheep blood agar or CNA agar. Continue. The presence of a single type of bacteria growing at high colony counts is considered positive urine culture. For clean catch samples that have been properly collected, cultures with greater than 100,000 colonies forming unit CFU per ml of one type of bacteria usually indicate infection. The presence of white blood cells and low numbers of microorganisms in the urine of a systemic person is a condition known as acute urethral syndrome. If a culture is positive, susceptibility testing may be performed to guide treatment. Any bacterial infection may be serious and can spread to other areas of the body if not treated. Pain is often the first indicator of an infection. Prompt treatment, usually with antibiotics, will help to alleviate the pain. That is all about my case study. Thank you.